So the single most important thing I think that clinicians can do to save lives and reduce suffering in the world is understand that they no longer are alone. For the last century, we've triumphed because the clinician accumulated knowledge and skill, and we crammed it into our heads and we tried to memorize it and execute on it ourselves. But the reality is now there's so much knowledge and so much technology and capability that we each end up with only a piece of care. More and more it's groups of people. I hesitate to call them teams because most people experience that there are gaps between the different clinicians who are involved in care, that the nurse may not be speaking to the doctor, that the specialist may not be speaking to the primary care physician, and it's the human being who falls between the cracks. Making teams work, understanding what it is to be really good at being on a team, that there are some times when you have to know how to lead and bring others around a patient, and other times when you need to give the leadership to others and be the follower in order to be effective for a patient. That today is turning out to be the single most important thing we can do when teams are able to connect and coordinate and make successful connections with patients and one another. The results of care, the survival, the levels of suffering, and by the way also the cost, are all phenomenally better.